The Erasmus University Medical Center is the largest medical center in the Netherlands, covering a catchment area of approximately 4.4 million people. And it is in that region the only tertiary care center and has, as a result of that, a very strong focus on top-level care.
The Department of Gastroenterology and Hepatology of the Erasmus Medical Center is an academic facility providing care to patients with advanced GI disease and patients with hepatic diseases. Besides that, we're also a training facility where we provide, of course, training to medical students, but also to residents training to become gastroenterologists. And lastly, we're also a research center. We do lots of clinical trials and translational research to finally improve the quality of life of our patients. Our endoscopy facility is quite large. We do around 13,000 procedures per year, and besides the ordinary diagnostic modalities that we offer, we mainly focus upon advanced interventional endoscopic techniques.
In the endoscopy department of the Erasmus MC, we focus on tertiary procedures and tertiary referrals, which is the vast majority of the procedures we do. Our unit is run as a team. The team consists of fellows, staff members, but also very importantly our nurses. In our department we offer a lot of different types of training in advanced endoscopy. This can be focusing on EOS or ERCP or on advanced endoscopic resection techniques like EMR and ESD. We do quite a lot of research on endoscopy, mainly focusing on biliary diseases, pancreatic disease, and also resection techniques like EMR, ESD, and palliative procedures like gastrointestinal stenting. We'd like to deliver the best care possible for our patients, both in diagnostics but also in therapeutics, sometimes palliative and sometimes curative care. The developments in endoscopy are going very quickly. I think it's very important to implement these developments in routine patient care, and that is something we try to focus on in our unit.
We also have a liver unit where we take care of patients with advanced liver disease, patients with hepatitis, with hepatic cancer, but importantly also we have the largest liver transplant unit of the Netherlands.
At Erasmus MC, the liver unit focuses on viral hepatitis, both hepatitis B, C and E, research on cholestatic liver disease and on research in vascular liver disease. We have a very busy liver transplant program. We do 50 to 60 transplant in adult patients, adult recipients each year. We have a very good cooperation with the surgeons. One of the specialties of the liver unit in Erasmus MC is doing ultrasonography by hepatologists and not by radiologists. You can match the picture with what's ongoing in the patient, and that's quite special. We have research going from the patient to the lab and then again back. For instance, for hepatocellular carcinoma, we're now working on trying to develop new treatments by really going back to the lab, trying to elaborate mechanisms, and from there on getting this knowledge back to the patient. That's a long-term project, of course, but I think that's the way to go.
The laboratory for gastroenterology and hepatology at Erasmus MC contains the full spectrum of investigations needed to answer clinically relevant questions. And we have our own diagnostic capacity, which makes us that we can implement the fruits of our research ourselves here in our own organization. Our laboratory is very strong in personalized medicine. We are able to find a very small subgroup of patients which are likely to benefit from a specific treatment. And we find those patients based on their microbiome, on their genetic makeup, or based on cellular biochemical parameters which we see in the clinical material we get from those patients. For instance, pancreatic cancer patients have very limited treatment options. A small minority of the patients, however, reacts to certain medication. So we have identified those biomarkers which allow us to pinpoint those patients which will benefit from rapamycin. And those patients, of course, live longer because of the research we do here. The success of our laboratories is, I think, exemplified by the great attraction it has to research abroad. 12% of all Chinese Scholarship Council students who come to the Netherlands come to our laboratory, and we try to reach out to everywhere over the planet and be able to bring our research to the highest international level imaginable.
What is truly unique about the research in our department is that we have our own statistician methodologist employed in our staff. because we feel it's of utmost importance to make sure that in the end what we publish is not only good but also valid.
It's exciting to work as a statistician within the Department of Gastroenterology and Hepatology because you get into depth of the medical topic. My role in this, and together with the PhD students, is to make sure that the data is good quality. We make sure that it's verified, so that keeping the integrity high. Within our department, we're very fortunate to have our own clinical research bureau. They make sure that the infrastructure of the studies are good. They maintain also all the rules and support the PhD students in performing their clinical and scientific research.
What we try to accomplish within the department is to bring excellent care to our patients, to provide challenging educational activities to our students and to our residents, and finally to do top-notch, high-quality research that makes a difference for our patients.